So my name is Mary Selby and I'm a tenant dairy farmer in Cheshire. The farm has been in the family for about 85 years now, my granddad coming here in 1940. I was originally a surveyor and then found that my real passion was in dairy cows, so I came back to the business about 8 years ago, absolutely loving it. So we milk 100 pedigree Holstein cows here. In 1967, unfortunately, my dad suffered with foot and mouth, and in 1968 they decided to restock with Holsteins from Canada. They took a 3-week sea voyage to get over here. Since then we've been a closed herd and our emphasis has been on maximising yields, focusing on genetics and reducing our costs. We're very keen to protect our cows with a closed herd. Biosecurity is a big thing for us, keeping disease at a minimum. We keep our cows in the autumn and winter months, feeding them a feed of silage and whole crop and a customised blend. In the spring they go out to graze, trying to make the most of the grass. We are predominantly autumn calvers, calving between September to December. I suppose more of an autumn flush, with a few tending to fall into January, February, March. We're currently on 10,400 litres from twice a day milking. I first came across Q fever in 2023. I attended the National Young Stock Conference at Harper Adams, and there was a talk about Q fever. I read the blurb and it had mentioned how this disease, it's a zoonotic and it can cause flu-like symptoms in humans. This was a particular interest for me. I have 2 young children and forever being struck down by some sort of bug or virus. Children were getting better, I wasn't, and I was convinced that perhaps it was something from the cows. So with our high yielding cows and having this push for more autumn calving, we were really asking a lot from the cows to get them back in calf, but we were struggling a lot with abortions, the interval between calving and conception, early pregnancy losses, cases of metritis. We weren't necessarily seeing lots of heats, even though we were using heat time detection as well. So it was a big area we needed really to focus on to keep our yields going and help us with our calving pattern. So I use Sandstone Vets, they're Cheshire based here on the farm, and we decided to take 2 samples from the milk, one looking at the bacteria and one looking at the antibodies. Both came back positive and one with a particularly high result. So from there we're very keen then to let's do something about this, let's get on top of it. We started vaccinating in 2023. It was in the autumn and we decided to vaccinate all our cows. This included the heifers that were due to calve as well. We did the vaccinating over 3 weeks. It was very straightforward. It was a small dose for each cow, and we've vaccinated again the following year, but this time those ones that have already been vaccinated only needed 1 more dose. So my motivation for vaccinating was to really try and get on top of this disease. We know it had so many implications on fertility, and it was a way which we thought was a simple way to really help the cows. So in 2023 we did our first course of vaccinations. Within a few weeks we were seeing so much stronger heat from the cows, so much more confidence in them standing. There was just so much more going on which we hadn't seen in previous years. So this meant we could start serving sooner. Following the first vaccinations in 2023 and then our first calving season following that in 2024, this has been our best season ever. We've had minimal abortions, hardly any early pregnancy losses, hardly any metritis. It's just been so much easier and I've been really, really pleased with what we've done. I do think there is a lack of awareness in the farming community about the disease. It is a zoonotic, and so I think it's something which we should be getting on top of and just deal with it. It's straightforward enough to deal with it. It is difficult to get tested, but it is possible to do so. My result came back negative, but for me, peace of mind, I am going to keep on top of this disease and keep those cows thriving.